Okay. Yes, so my name's Jamie. I work at Helston and I work across the acute wards and with the crisis resolution home treatment team. So I've been asked to come and talk about self-harm. So it's got a very formal title, but really it's kind of why do people self-harm and what can help is kind of what we're aiming at. It's a really huge topic, so I'm going to just kind of cover a small aspect of it that hopefully helps physical and mental. They say that in terms of self-harm, the definition of that is an act of self-poisoning or self-injury carried out by an individual which is irrespective of motivation. So what that means is that the motivation sometimes can be that people do actually want to end their life, but sometimes the motivation is for other reasons, which we will obviously talk about. So it kind of covers a wide range of things, really, as you can see on the list here. So just kind of running through that list, I mean, obviously the most obvious is suicide, and suicide is kind of has an overlap, but it's also a separate topic, and I'm not actually going to talk about suicide because we're focusing on self-harm. But obviously that is an act of self-harm. Overdosing is probably one of the ones that people will think of when you think about self-harming often. So that can be a range of self-poisoning, which could include medication. So self-poisoning, that can include medication, prescribed medication, over-the-counter medication, recreational drugs, and severe alcohol intoxication, which would be with a kind of intent to harm. Cutting, asphyxiation, which is ligaturing, burning. People can kind of insert objects, ingest objects. There's obviously hitting, punching, kicking, scratching, picking, gouging, biting, head banging. So it covers kind of such a wide range of things, really. And again, it's always thinking about it's the intent to want to harm yourself. And I guess we can all at times relate, I keep moving from the microphone, that perhaps sometimes people might go through phases where actually what they do could be considered a bit harmful to themselves. They might go out and drink too much alcohol. They might eat too much and kind of make themselves unwell. But obviously, generally people are probably able to recognise that and not want to continue, whereas obviously other people, they're doing it because it's a way of relieving distress and it's kind of something that they're intending to do. So just looking at some facts about self-harming. Looking across 17 different countries, they found an average of 2.7% of people had reported a previous episode of self-harm. Interestingly, looking at, that's only 0.5% in Italy and 5% in the USA. So that's kind of interesting to think about in terms of maybe some cultural differences. Within the psychiatric population, so people obviously with some diagnosed mental health problems, there's an overall 5.6% lifetime history of suicide attempt, slightly higher in women than in men. And self-reported lifetime history of self-harm without lethal intent is 4.9%. And again, that is slightly higher in women than it is in men. The majority of people who self-harm, they do normally sadly come from a childhood history where they have experienced some kind of abuse, or they've perhaps had a history of parental deprivation or neglect. And that's kind of what we see a lot in acute services, is people who kind of use that as a way of kind of coping. They often have had very difficult early life experiences, and they experience a lot of very difficult emotions around that. The Royal College of Psychiatry website said in 2010 that around 1 in young people will self-harm at some point. I don't know if that's even maybe going up a little bit, unfortunately, because I think it does seem to be the case that more young people are self-harming, but perhaps there's also more recognition of that. I think it's important to say, though, that even though 1 in 10 will self-harm at some point, it might be that that's something they do temporarily, that it's kind of like a phase, if you like, which they're struggling with, and that it doesn't necessarily mean that they're going to go on and use that as a longer-term strategy. So what factors can increase somebody's risk of likely to self-harm? The obvious one is obviously to have a psychiatric illness, so a mental health problem. Alcohol or substance misuse, and I think that's definitely the case with younger people is often when people have taken substances or they're intoxicated, they're more disinhibited, they're more likely to be impulsive and behave in ways they wouldn't normally, and that could also include harming themselves. Low social support, so people with less of a network in terms of friends and family are more isolated. A significant life event, that can often cause people to feel such a level of distress and struggling that again they might resort to self-harm as a way of trying to cope. Debt, which is again kind of adds to the psychosocial factors really. A history of being abused, as has been mentioned. A recent physical illness, so sometimes people's adjustment to just having become physically unwell and the impact that might have had on them means that's very difficult for them to cope with. If they're single or divorced, family history, which again might also relate to mental health problems, so if there's been that family history as well, and unemployment. And I think generally what we're seeing actually is maybe by the nature of how things are in society at the moment and the struggles, that actually we see more people coming through with mental health problems following significant life events, and also things like debt, unemployment, divorces. I think that just seems to be on the rise, and therefore also people are kind of struggling more emotionally because of it. And what about the characteristics that make people more likely to self-harm? So thinking about people, like how they behave, how they are in their character. So one would be feeling hopeless, and I guess that also links to kind of the suicide, thinking about that if people are feeling very hopeless about life, they don't feel they've got a future, then they are more likely to kind of think about things that will kind of help them cope with that, or because they feel actually very bad about themselves, that they kind of again resort to self-harm. And obviously in some cases that can also lead to them attempting suicide with an intent to take their own life. What we find is also that a lot of people that self-harm, they just don't have very good problem-solving skills. So we all at times have difficult life events, have things come along that is really hard to cope with, that affects us significantly in our emotions. But perhaps a lot of us have a range of ways of managing that, of thinking things through, of solving problems, of talking it through with others. There's the group of people that self-harm, they probably don't have a lot of those things. They don't have all those resources, and so they just want to get rid of how they're feeling, or they just want to kind of distract themselves, and so they kind of think self-harm is perhaps the answer in that moment. People who are impulsive are perhaps more likely to self-harm, and so by that we mean kind of people who find it more difficult again to slow down and think about the consequences of how they behave. They tend to react, and often that reaction is kind of in terms of how they feel. So linked to the feeling hopeless really, that not being able to think positively about the future again is kind of means that they're going to be in a very negative place where it's going to be hard to think about anything positive and feel good about themselves. High levels of self-criticism. So again, what we find in people who self-harm is that their self-esteem, their sense of how they feel about themselves is very low. And so when something perhaps we might see as quite minor happens, they will tend to very much go into a place where they feel like it's their fault. They become very critical of themselves, very blaming. They feel perhaps a lot of guilt or shame, and they sort of direct it towards themselves, almost like they feel they should be punished for that. And that sort of links to perfectionism. So again, people who are perhaps a bit more perfectionist in how they are, their characters, they again are more likely to be self-critical. They're more likely to quickly view things that are kind of quite minor that go wrong as something major. And again, they perhaps would then turn it on themselves and become very blaming. So why do people self-harm? Well, there's so many different reasons. There's not one or two answers about that, because we're all complex individuals, aren't we? And it's often related to kind of what's happened to that person individually. But I mean, I guess kind of thinking about it, one of the main reasons, I guess, is to regulate, i.e. to try and manage or to distract from feelings that are incredibly difficult for people, which can be things like anxiety, anger, guilt, shame, or even sexual feelings. And again, they're feelings that we all can have at times, aren't they? But we perhaps would find ways of kind of dealing with that, of working through it. But for people who self-harm, that's their kind of main strategy. And often people who, particularly things like cut or burn themselves, inflict kind of that kind of pain, they say it's actually a relief to them that they can feel something physical, because obviously when you feel things emotionally, really, people can't really see that. So to have something physical, it's a distraction, because then they'll experience that physical pain. But also sometimes it's because then they can see it and other people can see it, and it's a way of them kind of communicating their distress. So related to that, it's kind of to try and increase the sense of control they might have over their emotions. Like I said, to communicate this inner unseen pain. Sometimes it can be because they do want to seek help, and again, it's very hard probably when people feel very distressed to really communicate that effectively and in a way that kind of makes sense to others and gets people's attention. And so self-harming as a way of doing that is kind of quite a dramatic sort of way of being able to get some help. Sometimes people, because of often early life experiences, they can feel go through phases where they feel quite detached from themselves, almost like they're in a dream-like state, particularly when they feel very emotional about something. And so again, kind of self-harming kind of grounds them, it brings them back to a physical sensation. And sometimes that can be about seeking sensations, so they feel so numb, they just want to feel something. And like I've mentioned before, kind of self-punishment. There's also other things to think about. So sometimes it can be because perhaps people they feel very angry and they want to punish others. So harming themselves is a way of doing that. Sometimes it enables them to care for themselves. They find it very difficult to show themselves care, look after themselves, and if they've got something physical that maybe needs kind of a bandage put on it, that they can kind of do that for themselves. And of course, it's important to say that sometimes people who become psychotically unwell, they can self-harm because they're responding to voices that are telling them that they're bad and that they need to harm themselves. And I suppose taking account of all that list, it's important to say that usually the key thing is that they just want to escape from an unbearable situation and from feelings that just feel intolerable. And that can really vary. So on one occasion they might do it for one reason, but on another occasion it would be for something else, which is why I said it's complex. It's kind of there's not one answer really. So what does it feel like to self-harm? Because I guess if you don't self-harm, it can be something that can be really difficult to understand. Why would you want to harm yourself? Why would you want to inflict physical pain? Well, the majority, like we've talked about, feel absolutely intense, acute anger often, or dissociation, which is that sense of being completely separate from themselves, completely dissociated, just prior to self-harming. And that will often drive that anger. There's times when we perhaps all feel angry to the point where we might want to do things or behave in ways we wouldn't always. Anger is a very powerful emotion in that sense. So when people feel incredibly angry, it's a way of just trying to release that. The majority of people actually say that they don't experience pain when they do self-harm, and I think again that relates to the intense emotions that people kind of, when they're feeling particularly things like anger, they often can lash out and not kind of feel that until they've calmed back down again. And then afterwards, people say they tend to feel this sense of relief, this calmness following their self-harm. So of course that kind of also often reinforces the idea of doing it again the next time they feel a lot of emotional distress, because they feel a lot better after it's happened. And that links to sort of biology really, is that one biological process is that it may be that they have endorphins released as a result of being in pain. The body often does that when we experience physical pain. It releases the endorphins to help kind of distract from it, to make that pain less intense. And of course, endorphins are those feel-good kind of chemicals. That's why we can't promote exercise, because often it releases endorphins, we feel better. So it therefore does relieve their pain and also can help calm them down, make them feel better. And there's some thoughts that serotonin might also be involved. So in that sense, I guess, then you could think, well, self-harming, is that actually, from their point of view, an effective solution to a problem that they feel unable to solve in any other way? So thinking about just before the self-harm, what factors might contribute to that. It could be an external event that feels uncontrollable, they have no solution to, and leads to overwhelming emotional distress. So that could be a life event or somebody else kind of saying or doing something that they found very upsetting. Sometimes it can be a trigger that's internal, and that, you know, in the sense of being within them, they might start to have flashbacks, for example, from traumatic events that have happened to them. They might be experiencing difficult memories that they feel they can't get out of their head, and it's going round and round. And the same with, they might become very worried about something, and again it's kind of going round and round in their head. They don't know how to deal with it, they don't feel they can communicate it. And linked to that, I guess, is often this feeling of this surge of strong emotions, such as anger, guilt, shame, anxiety, or hopelessness. Important to think about other influences though, and I think this is the same really with thinking about our emotional well-being generally. A lack of sleep can have a huge effect on people's emotional well-being, and that is the case for everybody, isn't it? If you don't get a good night's sleep and then you start to chronically not sleep well, everything in life feels a lot more difficult to cope with, and people do tend to often find they become more irritable and they just struggle more. The same with food really, and I think often people with a history of self-harming, they do find it really hard to look after themselves with the basics, as it were. So they often don't get good sleep. They don't tend to often eat well, so they might have poor nutrition, they might not have enough calories, they might have a relationship with food that's very difficult, so they might go through phases of binging or purging. Obviously, misuse of medication or illicit drugs and alcohol will have an influence. Physical illness, but particularly, again, thinking about self-care, that failure to be able to really attend to their illness and look after themselves in the way they need to. But it can also be that people will say that perhaps they're bored, they lack stimulation, there's not enough, and that, again, self-harming is a way of kind of getting some stimulation. And I think that the thing to think about with the self-harm is to remember that the urges people will talk about become kind of all-consuming, and often I've worked with a lot of service users who say that it becomes almost like an obsession, that that's all they can think about is that they want to self-harm, and they're just going over and over in their head how they're going to do it, what opportunities might come up to do it, and that once they start on that path, they cannot stop it unless they self-harm. And once they self-harm, it's like it relieves them from those obsessional worries as well. So thinking about putting that all together then, how does an incident of self-harm happen? Well, you've got the vulnerability factors that we've referred to. The early life history is a vulnerability, current life stresses, a lack of self-care. Then you've got the specific triggers, so the event that's happened just before they're likely to self-harm, which could be something external they can't control, or it could be kind of what's going on inside their mind at the time. Then the emotional state comes into play, so they start to feel emotions that they can't tolerate very well, those emotions kind of build up. They start to get these urges to self-harm. Of course, they then self-harm, and that means that kind of relieves how they're feeling, because actually often they don't have the other coping behaviours. So now getting on to thinking a bit more about how can I help somebody who self-harms, thinking about it from kind of a carer's perspective rather than professionals. I think sometimes when people self-harm, it understandably brings up all sorts of emotions in people. it can bring up kind of anger, it can bring up huge levels of worry and anxiety, sadness, distress. And it can also kind of, the physical act of the self-harm can also distract from what's going on emotionally. And I think one of the things that's really important is to understand that they are, at that moment, feeling a lot of emotional distress, and they need some understanding around that. And that can be really hard to do when somebody's self-harmed. And like I said, the physical act of it can often also distract from that. It's sort of, you almost forget that bit. The other thing is to try to be non-judgmental. And again, I think that's a real challenge at times, and that's okay to say that it's kind of, it goes against what we feel as humans, isn't it, to kind of want to harm ourselves. Often when we become physically unwell, we work really hard to try and recover. So it can be very hard to understand why people do that. And I mean, I think sadly it is getting a lot better, but when people self-harm and they go to A&E, they can find that they get a lot of judgment about that, because again, the A&E staff, they find it really hard to understand. They've got all these people coming in with physical situations and physical symptoms, and then they've got somebody who's come in and they've kind of intentionally done that to themselves. But of course, the more judgment there is, the more that person who's already feeling very bad about themselves is going to feel worse. Another thing is to acknowledge how hard it is to talk about self-harming. And sometimes there can be that pressure to want to talk about it. Why are you self-harming? Why would you want to do that to yourself? And sometimes, probably quite a lot of the time, that person doesn't really know. It takes a long time for them to learn exactly why they self-harm and put that into words. And I think the other thing around that is about trying to show that you love and care about them no matter what. Because often that is what they're looking for. They're looking for just kind of that acceptance, I suppose, that's not conditional. So what doesn't help, well, as I've sort of mentioned in terms of thinking about A&E, I think being critical or dismissive of someone's distress when they've self-harmed, again, sometimes that can be quite easy to do, but of course that just completely reinforces to them that they're a bad person and that they're not being heard. I think often, again, with more education it's getting better, but self-harming always used to be labelled as attention-seeking or manipulative. That person's doing it on purpose because they're trying to make me feel X. And yes, it might be that one of the reasons they are self-harming is because they do desperately want attention, but it's not in that sort of negative, they're just doing it to attention seek. It's because they're in distress, they don't know how else to communicate it. And if we just label it as an attention seeking or manipulative, that's not kind of, going to help them, and they're likely to maybe even increase their level of self-harm as a result. I think the other thing that everyone can get caught in, I think sometimes that can happen with us professionals, but also I'm sure can happen with carers and families, is we start to believe we have to take responsibility to keep them safe. The anxiety around that person self-harming means that all of a sudden we feel we have to absolutely strip them of everything that they might be able to self-harm with. We have to be with them 24 hours a day. And actually, that isn't helpful. Most of the time, there might be occasions when it does really warrant that, but for the majority of the time, that's not very helpful, because I guess what we want to work on over time is them feeling able to take responsibility for their self-harm and work on ways of dealing with it and strategies that are different to the self-harm. And the other thing that, again, I've had a lot of service users say over time is that if they have the intent of self-harming, they will self-harm no matter what. If you strip everything away, they just might then end up using something even riskier to self-harm with, because that's what they want to do. So how else can I help? The path to compassion, kindness and self-soothing. So psychologically, when we work with people who self-harm, we now do a lot of work on promoting other coping strategies, ways of helping to regulate their emotional distress, helping them to problem solve and think about riding the waves of emotions, if you like, kind of getting through that. A lot of the skills that we teach now are based on the idea of compassion, kindness, like kind of soothing, which actually originates a lot from Eastern philosophies, kind of almost Buddhist type practices. But and I think a lot of it can also be very useful for all of us, actually. But the first thing is to think about reducing vulnerability to their self-harm. And this is kind of going back to basics a bit, which I think people do struggle with. Reducing caffeine intake is really important because caffeine makes you feel very adrenalized and kind of quite fired up. And of course, the more people have caffeine, the more they're going to perhaps get over-adrenalized and fired up. And if they're somebody that feels a lot of anxiety, for example, caffeine's just not going to help with that, because you're wanting to try and calm your system down when you feel anxious. You put caffeine in, you're just firing it up all the time. Also, reducing the intake of other stimulants like nicotine and alcohol. Eating regular healthy meals, regular bedtime and waking, because again, I suppose if people aren't sleeping well and they're up a lot of the night, that's a time when people are more likely to ruminate, they don't have distractions, and they're going to get caught in their sort of own thinking patterns. Decreased dependence on sleeping medication and tranquilizers. So often service users understandably probably want to take that medication because it numbs what they're feeling emotionally. But again, that's not teaching them sort of ways of how to manage it differently. To take their prescribed medication responsibly and regularly, getting regular exercise, and obviously to arrange and attend to health and mental health appointments. Another bit that's very important, I think, is people to find meaning and purpose in their lives, which actually we all need. That's kind of fundamental, really. And sometimes I think service users can become very lost in being able to do that. And the more they become mentally unwell and are struggling, the more they're going to struggle to find that meaning and purpose and get caught in kind of the system and kind of the sick role, if you like. So it's about taking part in activities they enjoy, that gives them a sense of achievement. Could be doing voluntary work, joining an education course, a social group with like-minded people. Going out to work would hopefully be an eventual aim for some people. Because I think what those kind of things also teach people is that actually sometimes you need to stick at things that are difficult or make you anxious, and over time that gets easier. And it's about learning how to encourage themselves to feel good about themselves. If they're not going out and doing those things, they're getting no feedback of like they're a valuable, worthwhile person in society, and actually they can also feel better about themselves. There's the encouraging learning of alternative coping strategies. So when people self-harm, they often have what's called a self-soothing deficit. So when they have these emotions come up that are very overwhelming, they don't know how to calm themselves down. And a lot of those self-soothing techniques we teach, it's not kind of rocket science, it's not kind of a magic answer, it's just often trying to be more in the moment and kind of sticking by that moment and knowing that it will pass, because actually all emotional states pass. The level of distress will come back down. And we all at times do things when we're feeling stressed or anxious or angry that just helps calm ourselves down a little bit. So that can be soothing through the 5 senses, and there's lots of different things that can be done with that. And in acute services, we try and teach service users some of those. Relaxation, which obviously we had a tiny bit of just this morning. Distraction, which is normally like, again, activities that perhaps have meaning and purpose that help distract from what they're feeling. And we now use a lot of mindfulness, which is doing one thing at a time with full awareness. And that's mindfulness comes from the concept of the mindfulness meditation, which is the Buddhist philosophies. But there's been a lot of mindfulness now that's been adapted for people with mental health problems, which Kabat-Zinn was one of the first people to bring. And there's now a lot of research to show that for people with all sorts of mental health difficulties, it is very helpful to learn mindfulness techniques. So one of the other things is to encourage them to think of the pros and cons of self-harming. Sometimes that can be helpful, and sometimes they might struggle to come up with some of the downsides of self-harming, and they might need help with that. But just almost kind of like looking at the list, there's always going to be some pros, but maybe also just writing it all out and looking at some of the consequences of the self-harm can be helpful when people are sort of trying to problem solve it. Reminding them that the urges will subside. Like I've just said, emotions are waves, they come and go. That is the nature of emotions, and you taking one moment at a time allows people to sort of ride those emotions a bit more. Whereas if they're very caught up in the past or in the future, that the emotions can easily and quickly become too overwhelming for them. Helping them to find ways of tolerating urges until they subside, which we've sort of mentioned. To distract from the thoughts and refrain from the behaviours. And sometimes we find strategies are helpful is to encourage, if service users really cannot give up self-harming completely at this moment, to think about techniques that are less harmful to them and that are less risky. Because obviously some of the ways that people self-harm, even if they don't have an intent of wanting to take their own life, there can be an ongoing risk of death by misadventure because they take that overdose that's just a bit too much, or they misjudge things. I think thinking again about carers, relatives, friends, there can be sort of traps that people can fall into, which again is very understanding. I think sometimes you can end up taking a parental role, and again it's about that feeling about I've got to take responsibility and this person isn't managing themselves, so I've got to be the parent. And that also perhaps then you get in this situation where you're kind of nagging the person to do the things suggested. And of course, a lot of the time none of us react well to nagging, and the more that that person feels they're probably getting pressured to do things, the less likely they are actually to do it. I think also showing a high level of anxiety, stress or anger when they've self-harmed is probably not very helpful for that person, even though it's very understanding. But it's probably also, you don't have to feel you have to completely hide your feelings, because it's also very normal that you would feel emotions around somebody that you care about has self-harmed. Sometimes it can be the situation where the anger means that perhaps people can make threats, they can want to punish or reject somebody when they self-harm, and thinking about the low self-esteem, the poor self-worth, again, that's just kind of reinforcing that person's negative feelings about themselves. And I think the expectation of change to be quick or to be consistent, and I think that is one of the hardest things again about the difference between perhaps mental health and a lot of physical health conditions is we can see physical health conditions often, but also often there's prescribed treatment and then people do get better. That isn't the case necessarily for people with mental health difficulties. It can take time for people to get better. There isn't one prescribed treatment, and also that might not be maintained all the time. Sometimes people will have relapses, people will have setbacks, and I think if there's expectations that that's not going to be the case, then that's really difficult for everybody because it feels like it's a failure. I think it's also important to be okay with the following though, and that is that it is okay to set some limits and boundaries of what is and is not acceptable regarding that service user's behaviour, particularly if it's in your own home. And I think if parents, families don't feel they can set some boundaries, they also feel very out of control, and that's not useful for sort of anybody. So often it's quite helpful to probably working with professionals involved to kind of think about that and think about some limits and boundaries. Being honest about your feelings. No one's perfect, we all have off days, so you're sort of modelling to them that it's okay to get emotionally upset and that actually you work through it. Making time for yourself, having time out to do things you enjoy. It's important to also tell others when you're struggling. I think families can feel they have to keep going and they have to sort of cope, but actually it's really important if you really feel that you're not able to sort of say, and to seek support from others in a similar position. And I know things like the carers support groups people can really value, because you can talk to people in similar positions, because I think even though there is a lot more education and understanding about self-harm now, it's still quite a taboo topic really, and it's probably something that's very difficult to sort of talk about with people who aren't going through a similar situation. So I guess that's sort of summarising the idea that there is no one magic answer, and what we say to service users is you've got to build tools to aid coping over time, and I think they can find that very frustrating because they want the behaviours to stop themselves, they get caught in these patterns, and you know, the idea of like having to think about it slightly longer term is very difficult for everyone involved. But actually these tools do work, and there's lots of evidence they work, but they do take time and practice. So I'm now going to show you a short clip, although I don't know.
I get really mad when my brother hits me a lot.
I don't like it when you say you don't want to play with me.
When I'm mad, my brain can get a headache and it can start hurting.
Your blood keeps pumping because you're like really mad. And you start to get sweaty because you're getting really, really mad. And then when you start getting really mad, you turn red.
When your body can't really control yourself, mad just takes over your body.
I just get out of control. It's kind of like if you had a jar and then the jar would be your brain and then you put glitter in the jar and that would be how you would feel like. If you shook up the jar and the glitter went everywhere, that would be how your mind looks. And it's like spinning around and then you don't have any time to think.
And you sometimes punch stuff and people when you don't really mean it.
When I get angry, I feel it in my heart.
I really don't like when I get angry. The amygdala really reacts, but the prefrontal cortex tries to keep it down.
When I feel like I want to, get really angry and yell, I just sometimes, take deep breaths.
First you find a place where you can be alone, then you find some way to relax and calm down.
When I need to calm down, I take deep breaths.
I breathe in through my nose. Sometimes I close my eyes or just take deep breaths. It's coming down, it's not moving. It's slowing down and then it stops. And the heart pumps slow and then it goes into your brain. It's like all the sparkles are at the bottom of your brain.
My brain slows down and then I feel more calm and then I'm ready to speak to that person.